Hi everyone, welcome to the last discussion for this semester's blood banking laboratory. And for this afternoon, we are going to discuss about antibody screening and identification. Okay, for the introduction, antibody screening is performed to detect antibodies against our RBC antigens, and this step is critical in pre-transfusion compatibility testing because without your antibody screening and identification, you would not be able to know if the patient will experience hemolytic transfusion reactions or immune hemolytic anemia. So these conditions are prevented if we are going to perform your antibody screening and identification. So it also aids in detecting and monitoring patients who are at risk of delivering infants with your hemolytic disease of the fetus and newborn. So again, the target of this step is to detect for the presence of irregular or unexpected antibodies that may come from our donors. So if in the antibody screening, a certain antibody is already detected, you have to proceed directly to an antibody identification step using panels so to determine the specificity of the antibody, because of course we have several antibodies coming from the different blood group systems. So once identified, the clinical significance and transfusion considerations can be put into place. So speaking of unexpected antibodies, our unexpected antibodies or irregular antibodies have categories. So we have four. The first one is what we call the immune alloantibodies. And these are unexpected antibodies of primary importance because they are produced in response to transfusion, transplantation, or pregnancy. So our RBCs are stimulated if there is entry of foreign materials into the body. Next, we have the naturally occurring alloantibodies. So these are formed as a result of exposure to environmental sources like your pollen, fungus, and bacteria, because these environmental sources have structures that are similar to some RBC antigens. Third, we have the passively acquired antibodies, and these types of unexpected antibodies are produced in one individual and then transmitted to another person through plasma-containing blood components or derivatives like your IVIG. Your IVIG is this is the shortcut term for your intravenous immune globulin, which is a product made up of antibodies that can be given intravenously through the vein, and these are antibodies that your body make to help you fight infections. Okay, so next we have for number four, we have the autoantibodies. These antibodies or unexpected antibodies are directed against antigens that are expressed on our own red blood cell surface and generally react with all the RBCs tested. So now we go to the antibody detection. So these are the following applications of your antibody detection. First, we have detection of clinically significant antibodies in allogenic blood donors. Allogenic meaning to say the blood comes from another person and it has to be transfused to another person. Okay, and in patients as part of the pre-transfusion compatibility testing for whole blood, red blood cells, and granulocyte components. Second, your antibody detection is a standard prenatal testing for obstetric patients for the detection of your HDFN and assess the mother's candidacy for. Okay, so now we go to the tube method, which is one of the several methods on how to perform your antibody detection. So IAT performed in a test tube is the traditional testing method to detect clinically significant antibodies. And here is the overview of the procedure. Well, actually, it's just the same procedure on how to perform your anti-human globulin test. Okay, so you have here your patient serum, It's mixed with the reagent RBCs that have known antigen content, and then you may include an IS phase to detect antibodies reacting at room temperature. However, step B is not required and may lead to the detection of clinically insignificant cold antibodies, because we are actually after clinically significant antibodies, and most of the clinically significant antibodies react at 37 degrees Celsius or during the AHG phase. Okay, next we have the step should also include a 37 degrees Celsius incubation phase. During this phase, your IgG antibodies, if they are present in the patient's serum, will sensitize any reagent RBCs that possess the target antigen. Next, um, enhancement reagents may be added to the test tube prior to incubation at 37 degrees Celsius to increase the degree of sensitization. Depending on the enhancement reagent added, the tubes may be centrifuged and observed for hemolysis and agglutination following this incubation phase. Then next, we have tubes are washed with NSS and your AHG reagent is added. So if the RBCs are coated with IgG antibodies, the anti-IgG antibody in the AHG reagent will create a bridge between sensitized reagent RBCs, resulting in observable agglutination. So if there are no antibodies directed against any of the antigen present on the reagent RBCs, of course, the RBCs will not be sensitized and there will be no agglutination. Okay, and lastly, centrifugation of tubes and examination for hemolysis and agglutination. Okay, so we have here the step-by-step illustration on how to perform the traditional way of performing your antibody screening. So in the immediate spin phase, which is an optional step, because remember in the previous slide, I have mentioned it there that the IS phase would only detect um, clinically insignificant antibodies that are cold reacting. Okay, but in the IS phase, you have here 2 drops of your patient's plasma plus 1 drop of the screen cell reagent. And then after that one, you have to add your enhancement reagent. Incubate at 37 degrees Celsius, okay, to increase sensitization of your red blood cells by the antibody. And if if the antibodies are present, RBC sensitization will occur. After that, you have to wash your sample 3 to 4 times with NSS so that unbound antibodies are removed. And then you have to add 2 drops of your AHG reagent so that your sensitized red blood cells will be cross-linked by antibodies that are present in your AHG reagent. And finally, you have to confirm the negative reactions by using your Coombs control cell. So take note that in every phase of your IAT, you should always try to read for the hemolysis and grade your agglutination. Okay, so here are some of the advantages and disadvantages of using the tube method as a procedure for the antibody screening. So in terms of the advantages, the test system is flexible. Second, the required testing equipment is always available and relatively low cost. However, the disadvantages of using this method are the following. Instability of the reactions and subjective nature of grading by technologists. Okay, because sometimes when we grade agglutination, probably in one medical technologist, the grading is let's say 2 plus, but then another medical technologist would grade the agglutination as 1 plus. So that is somehow subjective. Okay, and then second disadvantage, the amount of hands-on time for the technologist. And third, problems related to the failure of the washing phase to remove all unbound antibodies. Okay, so now we go to the different reagents that are used when performing the antibody screening. So we start first with our RBC reagents. So this one came from Group O individuals who have been typed for the most common and most significant RBC antigens. Our Group O cells are used so that anti-A and anti-B will not interfere in the detection of antibodies to other blood group systems. Screen cells are manufactured as a set, each having a unique combination of antigens. So within the reagent set or pooled reagent, there should be one cell that is positive for each of the following antigens. So we have antigens from the RH blood group system, like your big D, big C, big E, and small e. We also have your KEL, you have your Duffy antigens, you have your KID antigens, antigens from the Lewis blood group system, as well as your P, M, N, and S blood group systems. So other antigens will be expressed as well. An antigen profile sheet detailing which known antigens are present will accompany each set of your screen cells or pooled reagent. Another reagent that is used in antibody screening is your enhancement reagent, and these are added to the test system prior to 37 degrees Celsius incubation phase to first increase sensitivity of the test, and second to allow for a shortened incubation time. And these are the following most commonly used enhancement reagents for antibody screening. We have your 22% albumin, you have your low ionic strength saline, and your polyethylene glycol. So remember your zeta potential, which is the difference in the electrical potential between the surface of the RBC and the outer layer of the ionic cloud. This zeta potential is the reason why we are using your enhancement reagent, because um, if the zeta potential is decreased, it would be easier for our RBCs to agglutinate together. Okay, your 22% albumin, it reduces the zeta potential and it disperses the charges surrounding your RBCs, allowing your RBCs to approach each other and increasing the chances of agglutination. Your LISS, on the other hand, it contains glycine in an albumin solution, and in addition to lowering the zeta potential, your LISS increases the uptake of antibody onto the red blood cells. And lastly, your polyethylene glycol, this removes water from the system, concentrating the antibodies. So that is how your enhancement reagent functions when they are added in the test medium. Okay, next we have our AHG reagents. So remember our AHG reagents, they could either be monospecific or polyspecific, and they are added in the test system to allow for agglutination of our incomplete antibodies or our IgG because of their very small size or very limited agglutinating capacity. Any test tube that is negative for after adding the AHG reagent should be controlled by adding your Coombs control cells to really check if the reaction or the result is a true negative result. The addition of your Coombs control cells proves adequate washing was performed to remove unbound antibodies before the AHG reagent was added. So in a negative antiglobulin test, these antibody-coated cells will react with the anti-IgG in the AHG reagent that remains free in the test tube, resulting in a visible agglutination. So the AHG reagent was added to the test tube and the AHG reagent was working properly. So if the Coombs control cells fail to agglutinate, the antibody screen must be repeated from the very beginning. Okay, so now we go to the interpretation of our antibody detection results. So, a positive test result at any phase of testing indicates the need for antibody identification studies, and evaluation includes antibody screen results. Then you also have to look at the patient history, the patient's age, sex, race, diagnosis, history of pregnancy and transfusion, current medications, and intravenous solutions. And the investigator should consider the following questions. So, if the antibody screen of the patient is positive, these are the following questions that you should ask as an investigator. So, first, in what phase or phases did the reactions occur? So, if reactions are seen in the IS phase, that would mean that antibodies of IgM class are detected because these types of antibodies react best at room temperature or lower, or they are known as your cold reacting antibodies. So they are capable of causing agglutination of saline suspended red blood cells, or known as your immediate spin reaction, and most of the commonly encountered IgM antibodies that react in the IS phase are the following. You have your anti-N, anti-I, and anti-P1. Okay, so these are cold reacting antibodies. Next, you try to look at the AHG phase. So if there are reactions seen in the AHG phase, that would mean that most of the antibodies causing the reaction are of IgG class because they are known as your warm reacting antibodies. Okay, so those antibodies directed against your Rh, Cal, KID, Duffy, and SS antigens are usually IgG. However, there are also antibodies that would react in your 37 degrees Celsius phase. Okay, the 37 degrees Celsius phase, in this temperature, it's not only warm reacting antibodies that are considered significant, but sometimes there are also cold reacting antibodies that may react at 37 degrees Celsius. So, what are examples of these antibodies? So, you have Lewis and M antibodies. So, they may be described as both an IgG or IgM or a mixture of both. The second question that we are going to ask is the autologous control negative or positive? So guys, don't worry because later on I will be showing you a sample antibody screen where you can really see reactions and like how would we evaluate if the autologous control is negative or positive. So for now, let's try to understand first how to um, evaluate the reactions that we will see later in the antibody screen. So the autologous control is the patient's red blood cells tested against the patient's serum in the same manner as the antibody screen. A positive antibody screen and a negative autologous control indicates that an alloantibody has been detected, and if the autologous control is positive, transfusion history needs to be evaluated. However, if the patient has not been transfused within the last 3 months, a positive autologous control may indicate the presence of autoantibodies or antibodies to medication. If the patient has been recently transfused within the previous 3 months, the positive autologous control, which may exhibit mixed field appearance, may be caused by alloantibodies coating the circulating donor red blood cells. The third question that we need to ask is, did more than one screen cell sample react? If so, did they react at the same strength and phase or phases? So when we answer this question, we should categorize our antibodies into two types. They can be called multiple antibodies or single antibody, or the single or multiple antibody. So for multiple antibodies, that would mean that more than one screen cell may be positive, most likely present when your screen cells react at different phases or strengths, and screen cells react in the same phases but different strengths, or different phases and different strengths. For example, in the IS phase, it could be that the reaction would be 3 plus, 4 plus, 2 plus. So that would indicate that same phase but different strength. So that would indicate that there is presence of multiple antibodies. Okay. Another thing is multiple antibodies because reactions are seen at different phases and different strengths. So an example would be in the IS phase and in the 37 degrees Celsius phase, you can see different reactions of these two screen cells. So that would mean that there are multiple antibodies that are present. For single antibody, um, this is typical when reactions are in the same phases and the same strengths. Single or multiple antibodies if screen cells react at different phases but same strength. So this is an example of a screening cell for antibody detection, and what we can see here in the first column is our screening cells. Okay, and then in this part here, we have the different phases of your IAT, because take note that your antibody detection will have to follow the procedures of your indirect anti-human globulin test. And at the bottom of our screening cell is we have here our autocontrol. Okay, now when trying to evaluate for the screening cell, we have to answer or provide four important information. Okay, and these information include the type of antibody that is involved in the reaction. Is the antibody warm reacting antibody or a cold reacting antibody? And then is it an allo antibody or an auto antibody? And lastly, is the antibody a single antibody that caused the reaction, or are there multiple antibodies involved? Okay, now if looking at our screening cell here, notice that for the IS phase and the 37 degrees Celsius phase, for both screening cell 1 and screening cell 2, the reactions are negative, or sometimes that will be indicated by an agglutination grade of 0, meaning to say there is no agglutination um, observed in the test tube. And in our AHG phase, you can see a reaction here, as denoted by 1 plus for the screening cell 1 and another grade of 1 plus in your screening cell 2. Now, the first question here is, what is the nature of the antibody that caused the reaction in your AHG phase? Now, since our AHG phase detects for clinically significant antibody. So most likely, the antibody involved here is an IgG, because only your IgG antibodies are detected in your AHG phase. So the grade of 1 plus for both the screening cell 1 and screening cell 2 can be because of the presence of an IgG. Okay, so we have our first information here that the antibody involved in this reaction is an IgG. The second question would be, is the antibody a warm antibody or a cold antibody? Well, of course, since we are able to detect IgG, IgG is a warm reacting antibody. Okay, so that is another information. The third information is the antibody an allo antibody or an auto antibody? So to answer that question, you try to look at your screening cells. Okay, the screening cells, okay, this is our screening cells here. Okay, and then we have our auto control, right? Now, our screening cells, guys, we can see that the reaction occurred in the screening cells, as denoted by the reactions you can see under the AHG phase. And your auto control from IS phase to AHG phase, the reactions there are negative or 0. So since the reactions occurred in the screening cells, most likely the antibody involved is an allo antibody. You can only determine if the antibody is an autoantibody if the reactions in the autocontrol are positive. So for example, in the IS phase, the grading would be 2 plus, or in the 37 degrees Celsius, the grading will be 1 plus. That would mean that the antibody involved is an autoantibody. But sometimes reactions can be both seen in the screening cells and in the autocontrol. So you would be able to provide an information that the antibody involved can be an alloantibody or an autoantibody. But in this case, since the reactions are only seen in the screening cells, then that means the antibody is an alloantibody. So that is the third information. The fourth information is the antibody involve a single or multiple antibodies? Okay, so since the reactions only occurred in the AHG phase and they have the same grading or the same strength, so most likely the reactions here are only caused by a single antibody. You can you will know if it is a multiple antibody if under the AHG phase in the screening cell 1, if the grade is 1 plus, and the screening cell 2 gives another grading, let's say 3 plus, then that would mean that the antibody, there are several antibodies causing those reactions, so multiple antibodies. But since ganun siya, this is same phase and same strength, then the antibody is a single antibody. Okay, so that's how you evaluate for the um, presence of your antibody in the screening cell. So now we go to the antibody identification. So take note, guys, that if an antibody was detected in your screening cell, you have to proceed to the antibody identification so that you would be able to specify which antibody was detected in your antibody screening. So for the identification, so once an antibody has been detected in the antibody screen, additional testing or review is necessary to identify the antibody and determine its clinical significance. And when performing this one, you have to make sure that all the methods and test phases that you used in your antibody screening should also be the same methods and phases that you're going to perform when you are going to proceed to the antibody identification. Here are some techniques in antibody identification. There are two, your exclusion technique and your inclusion technique. So for the exclusion technique, when you're going to interpret the panel results, the first step is to not include antibodies that could not be responsible for the reactivity seen. And to perform this one, or to rule out the RBCs that give a negative reaction in all phases of testing are examined, and the antigens on these negatively reacting cells are probably not the antibody's target. So that is for the exclusion technique. For the inclusion technique, on the other hand, the remaining antigens that were not included should be examined to see if they have the same pattern of reactivity in the IAT phases of the antigen positive cells. So this table shows you guys the optimal phase of reactivity for some common alloantibodies. Um, so you have your antibodies, and at what phases of your IAT do they usually react? Okay, so for the immediate spin phase or the room temperature phase, or these are your cold reacting antibodies, you have your antibodies from the Lewis blood group system, your LEA and LEB. You also have your MNN, your LUA, and your P1. For the 37 degrees Celsius incubation, we have your potent cold IgM antibodies, especially those causing hemolysis. So take note, guys, that not all IgM antibodies are cold reacting antibodies. Some of them would usually react when exposed to 37 degrees Celsius temperature. Okay, and then some warm antibodies, if they are high in titer, like your D, E, and K, anti-D, anti-E, and anti-K. And for the antiglobulin phase or AG phase, or these antibodies that are listed here are your clinically significant antibodies. You have your RH antibodies, the antibodies belonging in your KEL blood group system, DAFI, KID, SS, and your LUB. Okay, so this is an example of an antibody panel that we use for antibody detection. I know, guys, that it's quite overwhelming. I mean, like maybe you are asking right now, how would I know which antibody to detect? Okay, or to identify? It's fine because I will teach you how to do it. Okay, so in this antibody panel, you can see here the different antigens. Okay, you have the different antigens belonging in the different blood group system. So these blood group systems are significant blood group systems. That's why they are found in this antibody panel. And towards the end of your panel, you can see the phases of your indirect anti-human globulin test. You have your IS, your HG, and you have your CC here stands for Coombs check cells. Okay? And then, take note na wala siya 37 degrees Celsius na phase. Well, most of the antibody panels, even if you try to browse through the hardening, the IS and the 37 degrees Celsius phase, these phases, sometimes they have negative or zero gradings, okay? So, the important thing here is the AHG phase, okay? Now, I will teach you guys the long method and the short method. But for this antibody panel on this slide, let's try first the long method so that you would be able to appreciate the short method later on. Okay? Sige. So, what you're going to do here is for the long method, you try to look at the AHG phase. So, take note that from the screen cell 1 up to 10, up to the auto control, the grading of the reaction is 1 plus. Okay, so even if it's a 1 plus reaction, that is still considered significant. Okay, because that would indicate that there is agglutination in the test tube. Now, for the long method, what you're going to do here is simple. Okay, you try to look at the first reaction of your HG phase. So the reaction here is 1 plus, right? Okay. For the long method, you try to look at the first row. Okay. Let's say for the screening cell 1, look at the screening cell 1 row. Now, since our AHG phase here, our AHG reaction here is 1 plus, try to look at the reactions in the first row and try to cancel all the reactions that are not the same with the reaction shown in your AHG phase. So again, diba, our reaction here is 1 plus. So try to evaluate each of the reactions you can see here and try to crash out the reactions that are not the same with your 1 plus. So what are these reactions? So the zero. Okay, we try to cancel all the zeros. Okay, because that means that they are not the same with the reaction shown by your AHG phase. Okay, so cancel ni sila tanan. Okay, medyo dugay. Okay. Okay, so we have, okay, in ani guys, once the antigen is already canceled, even if it's in the screening cell 1, all of the succeeding reactions for that antigen will have to be cancelled. Okay, so you have to crash this out also. Okay, this is the long method, guys. So, medyo long gid ni siya and I want you to be patient with me. Okay, so cancel ni sila. Again, if in the screening cell 1, opposite na siya og reaction sa imuhang AHG phase, you have to cancel the whole column of the reaction. Okay, so we're done. Okay, let's move on to the screening cell 2. For the screening cell 2, like your screening cell 1, they have the same grade, right, sa AHG phase. It's still 1 plus. So, the same with what we did a while ago. Let's try to investigate the second row and try to look for reactions that are opposite to your 1 plus. Okay, so sa may opposite sa 1 plus, that is a zero na grading of agglutination. So, let's try to look for the zeros here. Kani siya, this is crash out. Kanipod, this one included, and this one. And like the first row, if the antigen is already showing a reaction that is opposite to the grade shown in the AG phase, you have to cancel all the reactions in that column. Okay, so we have to crash this out. We also have to crash this out. Also this one. and this one. Okay, then let's proceed to the next. Okay, so the same lang. Let's try to look for the zeros. Cancel, 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 cancel this one. Also have this one. Okay, so crash out the whole column. That means that it's not included. Crash out. Also this one. And this one. Okay. Then proceed to the next. 1 plus ra gihapon. Try to look for the zeros. Cancel. Cancel. So crash out. And crash out. Then proceed to the next. 1 plus. Okay. Wala. And then, it's here, it's here. Let's try to cancel this one because they have opposite reactions. And then, next, we have this one. Try to look for 0. Wala. Next, this one. Just try to look for the 0. Okay, wala. Okay, so we have this one. Okay, cancel. This one. Okay, wala. And lastly, you have your 1 plus here. Okay. So, try to review again your antibody panel and try to look for the antibodies that were not, try to look for the antigens that were not affected with our crashing out of the opposite reaction. So what do we have here? Okay, so the remaining antigens that were not affected during the process is this one, your E from the RH blood group system. We also have K from the KEL, and we also have JSB still from KEL, and then we have LUB from the Lutheran blood group system. Okay, so the rest, they are not included because they were crashed out from the antibody panel. Now, looking at these antigens that have remained, and since the antibody detection is, yes, we are trying to detect for the antibody, that means to say that the antibodies are directed against these antigens. So when you try to evaluate for the antibody panel, guys, you are going to list this one as anti-E, anti-K, anti-JSB, and anti-LUB because we are trying to detect for or identify the antibody. Okay, so muna siya. You are not going to answer as E, K, JSB, or LUB, but you have to answer as anti-E, anti-K, anti-JSB, and anti-LUB because we are after the antibody against the antigen. Now, we do not stop here, okay? Because we still have to evaluate again your the IAT phases, of your procedures here. Okay, you have your IS and AHG. So take note, in our antibody screening, we have to look at four important information. The first one is to determine the antibody that caused the reaction, and then we have to determine if it's a warm or cold antibody, is it an allo or auto antibody, and lastly, if it's a single or multiple antibody. Okay, so let's try to assess our antibody panel. Okay, so looking at the reactions here, okay, looking at our reactions here, what do we see? Okay, all of the reactions are seen in your AG phase with a grading of 1 plus. Okay, since the reactions are only seen in the AG phase, most likely these antibodies are IgG in nature. Second, they are warm reacting antibody. Third, they are both an allo and autoantibody. Why both? Because if you try to look at the autocontrol, there is a reaction in your AHG phase. Okay, AHG phase. And is it multiple or single antibody? For this one, the answer would be, what do you think would be the answer for this one? Is it both single and multiple, or single only, or multiple only? Okay, the answer for that one is multiple antibodies. Why? Because even if the reactions are the same under the AHG phase, although, yeah, 1 plus siya, tanan under the AG phase, same strength. Take a look at, get there is a reaction in your autocontrol. Okay, so autocontrol is, or an autoantibody is another type of antibody. And remember that there are both allo and autoantibodies that are involved in this reaction. So there are multiple antibodies. Okay, so that is how you evaluate for your antibody panel for antibody detection. Okay. Okay, so since we're done with the long method, guys, let's try the short method. So for the short method, it's very easy. All you have to do is actually look for the antigen that has the same reactions with the reactions you can see under the AHG phase. So since there are no reactions in the IS and 37 degrees Celsius as denoted by a grade of 0, just try to focus on the AHG phase because your AHG phase has the gradings, okay? Gradings of agglutination. So, um, try to look for the antigen, and that antigen is your FYA, okay? Why FYA? Because, okay, let's try to trace. It has the same reaction in the first screening cell, okay? The same reaction po siya din eh. Okay, the same reaction with this one. The same also with this one and this one. And the last two reactions. Okay, but guys, when you try to compare the reactions, please do not try to skip the negative. Sometimes you would overlook and you might overlook and then opposite day sila o reaction. So please also try to look at the um zero or negative reactions of the antigen. Okay, so that is how you perform the short method. Okay, short lang jud kaayo siya. Okay, you just have to look for the antigen that has the same reactions with your AHG phase. But we're not done here because we still need to evaluate if the reactions you can see in the screening cells are caused by, is it an IgM or IgG? Is it a warm or cold reacting antibody? Is it an allo or auto? Or is it single or multiple antibody? So, looking at the reactions of your AHU phase, of course, all of the reactions are under the AHU phase. So most likely, the antibody involved here is your IgG. It is a warm reacting antibody, and it is an allo antibody because reactions are only seen in the screening cells, but there are no reactions in your um, autocontrol as denoted by 0 from IS to the AHG phase. And lastly, is it single or multiple? It's multiple antibodies as denoted by same phase but different strengths, okay, or different grading. So most likely multiple antibodies are involved here. Okay, so you have your anti-FYA as the antibody involved.